Thank you, Chairman. Good afternoon, ladies and gentlemen. In this brief segment, you'll be pleased to know it is brief, I'll be covering an overview, a snapshot if you like, of the operating result and the financial performance and position of the district for the 6 months ended June 2011. For you non-accountants out there or non-auditors, I'll make it as exciting as I possibly can. But there will be a few numbers. As Phil mentioned, this district effectively got underway on the 1st of January 2011, and so we have a 6 month, what we call a stub period. So the numbers I'm going to tell you, just double them in your mind, and that's the sort of numbers we'll be looking at for a full year next year. So for the 6 months ended, before I start, to give you a sense of scale on the size of this district, there are 15 local health districts across New South Wales, and depending on how you measure it, whether it be number of visitations or expenditure or population served or number of employees, between 1 and 3 is where we rank in this district amongst the 15. So it is quite a significant district we're all part of. In terms of the operating result for the period, in not-for-profit, which we are, we look at expenditure first. And the total expenditure for the period to June was $650 million. We also have some revenue, and the revenue was $67 million, which gives us what we call a net cost of services, $583 million. So that effectively means that our costs exceed our revenue by $583. I'll tell you how that's funded a little bit later. Looking at our principal costs, where does the money go in providing this important service to the community? Approximately $400 million is spent on staff-related costs. There'd be no surprise. We have something like 8,500 staff in the district. Related to staff, $30 million was spent on what we call VMOs, visiting medical officers, outside specialists who provide their services across the district. We also spent something like $187 million on what we loosely call other supplies and contracts, and that's obviously consumables and that are used throughout the hospitals in the district. It also includes payment to our partner third schedule hospitals across the district. Also, we have another thing called depreciation, which is an accounting term for the consumption of our assets. Buildings like this, the plant and equipment we use in the hospitals every day, they have a finite life, they wear out. So we try to measure that wearing out, and the cost of that was $22 million for the year. Just looking quickly at the balance sheet, this organisation employs a lot of assets to provide the services to the community. And in total, at the 30th of June 2011, we had some $990 million in assets that are brought to bear in providing the service. Phil already touched on the growth in the area, and Amanda will cover that later, but there's a lot of construction going on, and you've seen what's happening out the back here. So during the period, some $54 million was added to the carrying value of our assets, and that's going to continue to grow as other parts of the organisation like Campbelltown come on. Looking at the funding, I mentioned the $583 million. That is funded by appropriations and grants from the New South Wales Government, and more importantly and increasingly from the federal government going forward. But that doesn't mean because we're making a loss and we're funded by the government we can take our eye off the ball. It's extremely important that we measure our activities and our financial affairs very carefully, because as the Chairman mentioned, the resources are limited and we can never do everything we want to do. So we need to be very careful how we manage our financial stewardship of the operations of this district. Looking at the audit process, this is an annual meeting and it'll be normal to discuss the audit. The financial statements are really part of our external accountability to the community, to the Department of Health and to the New South Wales Government. The financial statements are subject to, they're prepared by, in this case, the Transition Authority. They will be prepared by our own finance team going forward. They were reviewed by an independent audit committee that serves this district, and they're also independently audited by the external auditors, being the New South Wales Audit Office. And as of yesterday, we're advised that the Audit Office have completed their audit and that they will be signing what we call an unmodified opinion, which in parlance, normal parlance, means it's a clean audit report and we should be happy with that. In due course, the financial statements will be published on the website for this district and also for the Ministry of Health. For those of you who want to go into a bit more detail, they'll be there. Now, before I wrap up, I would like to pick up a comment that Phil referred to, and that is really the enormous effort that's been made by the management team, and I also add the transition team as well, in transitioning from one huge organisation, the South West Sydney Local Health Network, which was a huge organisation, into two very large local health districts. An enormous amount of work, and that is still going on. So I'd just like to acknowledge that. I'd also use this opportunity to acknowledge my other members on the Finance Committee. That's Caroline Burlew and Associate Professor Mark Sheridan, and also the support of the board to our committee in undertaking its activities. And that's all I have. Thank you.